for CPC certification exam. Topic anesthesia coding. So basically, Sarika, we have in CPC exam from anesthesia, we have 4 questions. So the questions related to anesthesia will pertain to time reporting, qualifying circumstances, physical status modifiers, anesthesia for surgical diagnostic and obstetric services. So here we need to tell or we need to know time related to the anesthesia coding, and we need to know the qualifying circumstances, and we need to know physical status modifiers. So today we will start with our first question. Yeah, Sarika, now it is 9:16. You can discuss the answer at 9:19. So in CPC exam you need to write answer in 1.5 minute approximately. So we will follow that today. So now it is 9:16. You need to write it by 9:18 so that you will be practiced to write original CPC exam. Okay, Sarika? So just directly go to your book and check these ones, and within 2 minutes you need to answer. Yeah, go ahead, Sarika. So you have 1 more minute. So we'll check the answer. So patient came in for laparoscopic radical nephrectomy. Yeah, good, Sarika. You catched the answer. So no need to discuss this one. So P2 means it is a physical status modifier. The patient has controlled diabetes. We need to add P2. So your answer is correct. Okay. Hi, Sarath. Good evening. Yeah, go ahead and check. Answer question number 2. So now it is 9:18. So we will check the answer at 9:20. Hi, Anita. Good evening. So today onwards, we will practice original like CPC original exam. So I will give you 2 minutes. Within 2 minutes, you need to answer the question. Yeah, thank you guys. Thank you, Nagaraju. So here our answer is C. C is the correct answer. So why means 01830 here patient came in for distal radius fracture. Hi Anita, good evening. So patient came in for closed distal radius fracture, received monitor anesthesia care. So based on anesthesia guidelines, we need to code QS for monitor anesthesia care. So and P1 for healthy patient. So here our answer is C. Okay guys, we need to go QS modified to confirm that patient is received monitor anesthesia care. So our answer is C. So check third one. So now it is 9:21. We will discuss the answer at 9:23. No, Anita, only on weekends. Yeah, try for third answer. So we have one more minute. So you need to practice here itself. Yes, Sanita. Good evening, Srinath. Yeah, correct. Here our answer is the third question answer is B. 00326. Here we will not add 991002 0036 326 based on the guidelines provided under 00326. So our answer is B here. Okay, go ahead and check fourth question. So all are doing good. So keep it up. Just whenever you check a code, check the parenthesis under the code also so that you can eliminate most of the errors. Yeah, all of you write fourth question now. So if anyone has the difficulty finding the answer, please let me know. So we will discuss the answer now. Here, patient receives anesthesia per repair of cleft palate. So here, if we check 00172 anesthesia per intraoral procedure, including biopsy, repair of cleft palate 00172. So based on anesthesia guidelines, we need to add 99100 as patient is under 1 year. So here our answer is C. Here patient is only 6 months old. So we need to add 99100. Yeah, answer is C. So our fourth question answer C. All of you remember. So we will check fifth question. So now it is 927. We will discuss the answer at 929 or 30. So based on the answers. So you need to practice like this now so that you will be good while writing the original CPC exam. So in order to find this one, directly go to your CPC book. What Srinath? Please sir, make a one video about all appendix. Oh, appendix A, appendix B, appendix C like that. So you need all appendixes and what is the purpose of them, correct? Yeah, correct. Sarika, as you mentioned B, B is the correct answer. Yeah. So basically directly you can go to the anesthesia section of your CPT book and directly you can search. It is very easy. So using anesthesia services, you need to get 4 out of 4 in CPC exam. So you need to try like that. Yeah, question number 6. Congrats गौरव, आप तो पास हो जाएगा मुझे मालूम है. सो अपना क्लासेस कुछ फायदा हो गया आपको? आप तो कंटिन्यू आता रहता था. So Gaurav is our old subscriber who used to come to our session. He nearly visited nearly 10 sessions. He has passed his CPC exam. Tell congratulations to him. His name is Gaurav Shirde. So you need to take motivation from him and you need to practice your CPC exam. Nearly he has attended 10 sessions, 10 or 15. So he has passed his CPC exam now. So Gaurav, is these sessions are useful for you? सो आपका ये यूट्यूब लाइव सेशन से आपको कुछ फायदा हो गया है सीपीसी एग्जाम लिखने का टाइम? Yes, Sarika, you need to take motivation from Gaurav. He passed CPC exam. Okay, we will discuss this question number 6. Here our answer is C. So basically patient is having knee replacement surgery. The surgeon requests that in addition to the general anesthesia for the procedure that the anesthesiologist also insert a continuous lumbar epidural infusion for post-operative pain management. So the anesthesiologist performs post-operative management for 2 post-operative days. Yeah, I think Srinath here correct answer is C. So if you check 62326 and 62327, there is a amazing differences. Yeah, C is the correct answer. 62326. See, 62327 is with imaging guidance. 26 is without imaging guidance. So based on our documentation, there is no imaging guidance. So here our answer is C. As based on CPT guidelines, if anesthesiologist performs pain post-operative pain management, we need to code. So our answer is C here. Yeah, thank you, Anita. You did well. So check for question number 7 now. So now it is 9:34. We will discuss the answer at 9:36. Yeah, go ahead and check. Seventh question. Yeah, you need to try for 4 out of 4 marks in CPC exam while writing original exam. As these are very easy, so just so we have 1 more minute. We are now checking seventh question. So all of you concentrate on seventh question now. Yeah, thank you, Sarika. You did well. So our answer is A. Why A? I will tell you. So basically 00400 for that procedure. What do you call this one? Correct code for uh, removal of lymphoma from the chest. And QX modifier is for service provided by CRNA. And QS modifier is for monitored anesthesia care. So our answer is A, 00400 QX and QS. Yeah, thank you, Sarika. So go ahead and check. Eighth question. Yeah, go ahead and write. Eighth question answer. So you have 1 more minute. So first try to identify the keywords. So we'll discuss now. So basically postoperative diagnosis multivessel coronary artery disease. Name of the procedure coronary artery bypass graft times 3 left internal mammary artery to LAD saphenous vein graft to obtuse marginal saphenous vein graft to the diagonal. Okay, the patient is placed on heart lung bypass. So this is the very important distinction while coding this question. And also we need to check the timing. So anesthesia timing here. So timing is 6 p.m. to 12 a.m. 6 hours. So if you check in the CPT book 00566 does not have any or without pump oxygenator, but based on our documentation physician has used heart lung machine or pump oxygenation, both are same. So because of that reason, and time is 6 p.m. to 12 a.m. So because of that reason our answer is A here. So eighth question answer is A. Yeah, thank you guys. Sarika, eighth question is answer is A, Sarika. So here see here 6 p.m. to 12 a.m. We need to check this anesthesia time, not surgical time. You need to calculate anesthesia time. While we are coding for anesthesia now. 6 p.m. to 12 a.m. 6 hours and 00567 for our procedure performed using the pump oxygenator. So 00566 is without pump oxygenator and 00567 is with pump oxygenator. So our answer is A. Remember all guys? Yeah, okay. Check question number 9 please. So pump oxygenator, bypass mission, perfusion mission, all are same. Heart lung mission, all are synonyms. So whatever it is the word, same name. Pump oxygenator, heart lung mission, both are same. You no need to confuse among those two words. So now it is 9:41. We will discuss the answer at 9:43. First, you need to check the differentiation among two codes. Then you can choose the correct answer. First, you need to find the keywords in the document and you need to write the correct answer. So you have 1 more minute. So if you forgot to click on like button so that this video goes to the people who are in need of CPC knowledge. So because of you, they will pass the exam. Okay, thank you, Srinath. Thanks for your answer. Yeah, here our correct answer is B. So why means Sarika, you need to remember that here 00540 is for without ventilation, 00541 is with ventilation. So here our documentation does not mention anything regarding ventilation. So we can't code 00541, otherwise C or D. So we need to check among A and B. Here if you see the documentation, anesthesia provided by CRNA. For CRNA we need to use QX modifier. So here our answer is B, 00540 QK, 00540 QX. QK is for anesthesiologist, QX is for CRNA under anesthesiologist supervision. So our answer is B guys here. So try to remember. So you need to know that you need to master anesthesia modifiers here. Try to practice more about anesthesia modifiers. So you can write correctly. So we can check the 10th question. So now it is 9:44. We can check the answer at 9:46. So you need to know all physical status modifiers, all those things like P1 to P6, like CRNA modifier, anesthesiologist modifiers. You need to practice more on that so that you can't lose 4 marks, which are very easy. Thank you, Anita. You have 1 more minute. So basically, if you people do the mistake, I will explain. If you write correct answer, no need to check that one. Thank you, Sarika. So we will check the answer. A patient is given general anesthesia by anesthesiologist for carpal tunnel nerve release. So here we need to assign modifier A. AA. So as anesthesiologist provided the anesthesia, we need to code AA modifier. After the surgery, the anesthesiologist is called to perform an auxiliary block for postoperative pain management on the same patient. So here, based on CPT guidelines, as we have discussed previously, if the post-operative pain management is provided by the anesthesiologist, we can code. If the physician performs, we can't code. So here we need to code for post-operative pain management also. So again here, our code is, we will check first to B01840. So what is 01840? Anesthesia for procedures on arteries of forearm, wrist and hand not otherwise specified. And we will check 10 also, anesthesia for all procedures on nerves. So here basically Anita, you need to remember here physician is performing procedure on the nerve. See here he mentioned nerve release, not on the bone. So that's why we need to code C 018810. So our answer is C here. As physician or anesthesiologist provided anesthesia for nerve release. Otherwise, you can call it as related to nerve. If you check the description of 01810, anesthesia for all procedures on nerves, muscles, tendons, fascia, and bursa, forearm, wrist, and hand. So, it as physician performed this anesthesia on nerve, we need to code 01 01810 AA 64417 and 59. So, which is C. So, here our answer is C. Try to remember that, Anita. So you need to check whether physician performed procedure on nerve or bone. So if it is bone, your code is correct. But here physician performed procedure on nerves, we need to code GSC 01810. Okay. Yeah. No worries, Anita. Just to remember for next time. So if he does mistakes only, we can remember. So now it is 9:48. We can discuss the answer at 9:50. Just you need to differentiate what is the exact location of the procedure so that you can write properly. So basically, anesthesia is very easy topic for all of you guys. Just you need to check properly. Yeah, we have one more minute. Okay, guys, we will discuss the answer. Here, patient is came in for our patient's procedure is needle thyroid biopsy. Okay, the anesthesiologist begins to prepare the patient for surgery at 9 a.m. The surgery begins at 9:15 and ends at 9:45. The anesthesiologist transfers the patient care to the recovery room at 10 a.m. So, which is the appropriate anesthesia code and what is the anesthesia time? So, here if we check 320 and 322, what is 320? 320 is anesthesia for all procedures on esophagus, thyroid, larynx, trachea, and the lymphatic system of neck, not otherwise specified, age 1 year or older. Okay, that is correct. Hello, Prashant. Good evening. So, we will check 322 also. So basically our physician performed needle thyroid biopsy. So our 00322 resembles needle biopsy of thyroid. So here our answer is D. Why D? Here we are collecting 1 hour. So based on CPT guidelines. So anesthesia time starts when anesthesiologist prepares the patient for the surgery. See here, anesthesiologist begins to prepare the patient for surgery at 9 a.m. and whenever the anesthesiologist returns the patients to other specialty care, he will end his time. So see here, anesthesiast turn over the patient care to the recovery room nurse at 10 a.m. He transferred under anesthesiologist to nurse. So it is 9 a.m. to 10 a.m. 1 hour. So because of that reason, our answer is D. D is the correct answer. Well done, guys. So now we will check question number 12. Okay, let me make it down. So the people who are not writing, you can check the answer later words also. No need to worry. You can analyze your answer why it is wrong. So now it is 9:52. We will discuss the answer at 9:54. Basically, I am giving more time to you, but in a original CPC exam, mostly you have 1.5 minutes for each question. Yeah, thank you, Srinath. Thank you, Sarika. So we have 1 more minute. Yeah, we will check the answer. So patient is admitted for labor for delivery. She received labor neuraxial epidural for vaginal delivery. Okay. The baby goes into fetal distress and cesarean section is performed. Following delivery, the patient starts to hemorrhage. The physician decides with family approval to perform a hysterectomy. So basically here our answer is D, 01967 and 01969. So if you check the description, 17 01967 neuraxial labor anesthesia for planned vaginal delivery and 68 is for anesthesia for cesarean delivery following neuraxial labor anesthesia. So based on the CPT book guideline, we need to quote D is the correct answer. So initial for vaginal like initial first anesthesia for neuraxial epidural for vaginal delivery and second anesthesia for cesarean section. So our answer is D here. Okay, so go ahead and check question number 13. So if you don't understand now, you can watch the session tomorrow, no problem. So you can watch it as many times you want. Just you need to put extra caution while coding anesthesia. So we'll discuss 13th question now. Time over. Angiogram revealed three artery blockages. The patient has COPD, which is a severe systemic disease. The patient undergoes CABG times 3 venous grafts and cardiopulmonary bypass and cell saver. So as we have discussed previously, if physician uses cardiopulmonary bypass, so usually cardiopulmonary bypass is a heart-lung mission. So you need to code combination code here. So if you check 00567, it includes the anesthesia along with cardiopulmonary bypass or pump oxygenator. So because of that reason, our answer is C here. C is the correct answer. So Anita, if you check 00567, anesthesia for direct coronary artery bypass grafting, 66 is without pump oxygenator. But as I told you previously, cardiopulmonary bypass, heart-lung mission, pump oxygenator, all are same. So you need to code C here. 00567 is the correct answer. Yeah, go ahead and check. Question number 14. So check the question first and need to find the keywords. So if you identify proper keywords, you can code correctly. Yes, you guys have one more minute. Yeah, thank you, Sarika and Srinath. So here, question number 14 answer is C. 00102 P1 as patient is healthy patient. We need to add P1 modifier and 9910100 as patient is less than 1 year old. So our answer is C here. So all are doing good in anesthesia section. So you need to get 4 marks out of 4 while writing the original exam. So question number 15, please. So now it is 10. We can discuss the answer at 10 too. So as soon as you see the options, you need to check the keywords and find the answer. Okay, guys. So as soon as you see this question, you need to remember the modifiers first. As anesthesiologist performed MAC, we need to use the QS modifiers. So because of that reason, you need to directly you can eliminate A and C. So you need to concentrate on B and D now. And you need to check 01382 01400. So based on the documentation, physician has performed only diagnostic arthroscopy. Here there is no mention of therapeutic arthroscopy. So we need to code diagnostic arthroscopy, which is 01382. So here our answer is B, 01382 AA, and anesthesia performed by anesthesiologist, and QS modifier is for mounted anesthesia care. So as I told you, you need to master in all these modifiers so that you can code properly. So if you want, I will create one session for all these modifiers. So mention in the comments if you want, anyone wants modifier session. Yeah, go ahead and check. Last question of the day, 16th one. So I think this is the question we have done previously. Just to find the keyword and find the answer. And you need to remember that while coding anesthesia coding, you need to remember the patient's age also. Yeah, thank you guys. 00326 is the correct answer. So if you check the description, anesthesia for all procedures on the larynx and trachea in children younger than 1 year of age. So our patient's age is 9 month old. So we need to code 00326. Yeah, if you check 00326 in parentheses, you can find you can't code do not report 00326 in conjunction with 99100. So we can't code 00326 and 9910100 at same session, as 00326 already contains children younger than 1 year of age. So our answer is C here, 00326. 00326 is the correct answer. So you can remember. So as based on parentheses under 00326, do not report 00326 in conjunction with 99100. So basically we'll code 99100 for patients below 1 year of age, but based on our documentation and based on 00326 description, so we no need to code 99100 along with 00326. So our answer is 00326. So okay guys, we have completed this session for today. So next week we will meet. Now it is 10:06. I will wait for 5 more minutes. If you have any doubt, you can ask here. Now it is 10:06. I will wait until 10:10. If you have any doubt, we can discuss that. No worries, Anita. Just to whenever you write exam, just watch this video. It will be in the YouTube live on Fastcoder 21 so that you can remember all guidelines. So 320 is for older, Anita. So A is wrong here. So A is 1 year or older. 326 is A is 1 year or lesser. See, our patient says is only 9 months. Na. Welcome, Sharath. So if you have any concerns while watching our videos, mention in the comment section so that as soon as possible I see, I will reply to you. Thank you, Present. Try to attend next week also. Next week we can come up with new chapter. So if you don't have any concerns, we'll conclude the session now. Yeah, we can make one video, Srinath. So next week I will try to make one video on Appendix G. Okay. So you can check in YouTube videos, not here. Okay, guys, take care. We will meet next week. So basically, Anita, it is like, yeah, no worries, Srinath. Yeah, basically in CPT description, initial and subsequent. Subsequent means you can think like second time. So if first time the procedure is not success, physician will do the procedure second time. Subsequent means after the initial. So in other words, you need to think that it is second time physician performed that procedure. Yeah, no worries, Srinath. So I will try mostly to do this appendix G. So it is like second time physician is performing that procedure. So 53660 is for first time initial. 6x1 is for second time procedure, same procedure performed by the physician. That's very simple. So initial means first time, subsequent means next time, second time. So okay guys, see you next week. Okay Anita, is it okay for you? So you need to remember 660 is for first